You forgot where you put your keys again. You walked into a room and can't remember why. You blanked on someone's name, someone you've known for years. And there's that moment of panic. That cold fear. Is this it? Is this the beginning of Alzheimer's? Am I losing my mind? Take a breath, because I need to tell you something that doctors don't emphasize enough. Memory problems at 60 are not automatically Alzheimer's. In fact, most of the time, they're not Alzheimer's at all. There are dozens of other causes of memory loss that are reversible, treatable, and have nothing to do with dementia. And I'm going to walk you through the most common ones, so you can stop panicking and start figuring out what's really going on. First, let's talk about what's normal. Some degree of memory change is a normal part of aging. Your brain at 60 is not the same as your brain at 30. Processing speed slows down a little. It might take you a bit longer to recall a name or a word. You might be more easily distracted. This is called age-related cognitive decline, and it's completely normal. It doesn't progress to dementia. It doesn't interfere with your daily life. It's just your brain aging like the rest of your body. The difference with Alzheimer's is that the memory loss is progressive. It gets worse over time, and it starts to interfere with your ability to function. You're not just forgetting where you put your keys, you're forgetting what keys are for. You're not just losing words occasionally, you're having trouble following conversations or expressing basic thoughts. You're getting lost in familiar places. You're having trouble managing finances or cooking meals you've made 1,000 times. If your memory issues are mild, occasional, and not getting progressively worse, it's probably not Alzheimer's. So what else could it be? Let me give you the most common causes that doctors see all the time. Sleep deprivation. This is huge, and almost everyone over 60 is dealing with some level of poor sleep. When you don't sleep well, your brain cannot consolidate memories properly. Sleep is when your brain processes the day's information and moves it from short-term memory to long-term memory. If you're not getting enough deep sleep, that process doesn't happen efficiently. You feel foggy. You forget things. Your concentration is terrible. And here's the thing. You might think you're sleeping fine because you're in bed for 8 hours. But are you actually sleeping deeply? Are you waking up multiple times? Do you have sleep apnea? Many people over 60 have undiagnosed sleep apnea where they stop breathing repeatedly during the night. Their oxygen levels drop. Their sleep is constantly interrupted, and their brain suffers. Memory problems, difficulty concentrating, feeling mentally sluggish, all of this can come from sleep apnea. If you're experiencing memory issues, get your sleep evaluated. A sleep study can identify apnea. Treating it with a CPAP machine can dramatically improve cognitive function. I've seen people who thought they were developing dementia, and it turned out to be severe sleep apnea. Once treated, their memory came back. Medications. This is one of the biggest culprits, and it's often overlooked. Many medications that are commonly prescribed to people over 60 can cause memory problems and cognitive fog. Anticholinergic drugs are the worst offenders. These include many antihistamines like Benadryl, medications for overactive bladder, some medications for depression, some sleep aids, even some medications for stomach acid. These drugs block acetylcholine, a neurotransmitter that's crucial for memory and learning. When you block it, your memory suffers. And the scary part is that many people are taking multiple medications that have anticholinergic effects. The effects add up. You might be taking an allergy medication, a sleep aid, and a bladder control medication, and together they're causing significant cognitive impairment. Benzodiazepines, drugs like Valium, Xanax, Ativan, these are also terrible for memory, especially with long-term use. They're highly addictive, and they impair memory formation. If you're taking these regularly, that could absolutely be why you're having memory problems. Even some blood pressure medications, statins, and pain medications can affect cognition in some people. If you started having memory problems after starting a new medication, that's a huge clue. Talk to your doctor about alternatives. Often there are other options that don't have the same cognitive side effects. Vitamin deficiencies. Vitamin B12 deficiency is extremely common in people over 60, and it causes memory problems, confusion, difficulty concentrating, and even symptoms that look like dementia. As you age, your stomach produces less acid, which you need to absorb B12 from food. Many medications, especially those for acid reflux, further reduce stomach acid and make B12 deficiency worse. B12 is crucial for nerve function and brain health. Without enough of it, your brain doesn't work properly. The good news is that this is completely reversible. B12 supplementation or B12 injections can restore your levels, and your memory can improve dramatically. Vitamin D deficiency is another one. Low vitamin D is associated with cognitive decline and increased risk of dementia. Most people over 60 have inadequate vitamin D levels, especially if you live in a northern climate or don't spend much time outdoors. Getting your levels checked and supplementing if needed can make a real difference in how your brain functions. Thyroid problems. Your thyroid controls your metabolism, including your brain metabolism. Hypothyroidism, an underactive thyroid, is very common in people over 60, especially women. And one of the classic symptoms is brain fog, memory problems, difficulty concentrating, mental sluggishness. You might also have other symptoms like fatigue, weight gain, feeling cold, constipation, or depression. But sometimes the cognitive symptoms are the most noticeable. A simple blood test can check your thyroid function. If it's low, thyroid hormone replacement can completely resolve the memory issues. Depression and anxiety. Mental health has a huge impact on cognitive function. When you're depressed, your brain doesn't work as well. You have trouble concentrating. You forget things. You feel mentally slow. This is called pseudo-dementia because it looks like dementia, but it's actually depression. And depression in older adults often doesn't look like the classic sadness and crying. It can present as irritability, loss of interest in activities, changes in sleep and appetite, and cognitive problems. Anxiety can also impair memory and concentration because your mind is preoccupied with worry. You're so focused on anxious thoughts that you can't focus on anything else. Treating the underlying depression or anxiety, whether with therapy, medication, or both, can completely restore cognitive function. This is why a proper evaluation is so important. You don't want to miss a treatable condition like depression, dehydration. This seems simple, but chronic mild dehydration is very common in older adults, and it absolutely affects brain function. As you age, your sense of thirst decreases. You don't feel thirsty even when your body needs water. And many older adults deliberately drink less because they don't want to use the bathroom frequently, especially at night. But your brain needs adequate hydration to function. Even mild dehydration can cause confusion, difficulty concentrating, and memory problems. Drinking enough water throughout the day can improve mental clarity significantly. Chronic stress. When you're under constant stress, your body produces high levels of cortisol. Cortisol is your stress hormone, and while it's necessary for survival, chronic elevation damages the hippocampus, the part of your brain responsible for memory. High cortisol also interferes with the formation of new memories and the retrieval of existing ones. If you're dealing with ongoing stress, whether from finances, health problems, family issues, or anything else, that stress is affecting your memory. Finding ways to manage stress through meditation, exercise, therapy, or other methods can protect your brain and improve cognitive function. Blood sugar problems. Both high blood sugar and low blood sugar affect brain function. If you have diabetes or prediabetes, poorly controlled blood sugar can cause memory problems and cognitive impairment. Your brain runs on glucose, but too much or too little causes problems. High blood sugar over time damages blood vessels, including the tiny blood vessels in your brain. This reduces blood flow and oxygen delivery to brain cells. Low blood sugar, which can happen if you're on diabetes medications or if you're not eating regularly, causes immediate cognitive impairment. You feel confused, foggy, unable to think clearly. Getting your blood sugar under control, whether through diet, medication, or both, can significantly improve memory and mental clarity. Hearing loss. This one surprises people, but there's a strong link between untreated hearing loss and cognitive decline. When you can't hear well, your brain has to work much harder to process sounds and understand conversation. This extra effort takes resources away from other cognitive functions like memory. Also, people with hearing loss often become socially isolated because conversation is difficult and exhausting. Social isolation is a major risk factor for cognitive decline. Getting hearing aids and staying socially engaged can actually protect your brain and improve cognitive function. High blood sugar over time damages blood vessels, including the tiny blood vessels in your brain. This reduces blood flow and oxygen delivery to brain cells. Low blood sugar, which can happen if you're on diabetes medications or if you're not eating regularly, causes immediate cognitive impairment. You feel confused, foggy, unable to think clearly. Getting your blood sugar under control, whether through diet, medication, or both, can significantly improve memory and mental clarity. Hearing loss. This one surprises people, but there's a strong link between untreated hearing loss and cognitive decline. When you can't hear well, your brain has to work much harder to process sounds and understand conversation. This extra effort takes resources away from other cognitive functions like memory. Also, people with hearing loss often become socially isolated because conversation is difficult and exhausting. Social isolation is a major risk factor for cognitive decline. Getting hearing aids and staying socially engaged can actually protect your brain and improve cognitive function. Alcohol. If you're drinking regularly, even moderate amounts, it can affect your memory. Alcohol interferes with the formation of new memories. It disrupts sleep. It causes vitamin deficiencies, especially B vitamins, and over time, it can cause structural changes in the brain. Many people increase their alcohol consumption after retirement or during stressful times. If you're drinking every evening, that could absolutely be contributing to your memory problems. Cutting back or eliminating alcohol often leads to noticeable improvements in mental clarity. So what should you do if you're experiencing memory problems? First, don't panic. Second, see your doctor for a comprehensive evaluation. This should include a detailed medical history, a review of all your medications and supplements, blood tests to check for vitamin deficiencies, thyroid function, blood sugar, and other metabolic issues, a cognitive assessment to establish a baseline, and possibly a referral to a neurologist or geriatrician for further evaluation if needed. Be honest with your doctor about everything: how much you're sleeping, whether you're depressed or anxious, how much you're drinking, what medications you're taking, including over-the-counter ones. All of this information helps identify the cause. And here's something important. Even if you do have early Alzheimer's or another form of dementia, early diagnosis is valuable. There are medications that can slow progression. There are lifestyle interventions that can help. You can make plans for the future while you're still able to participate in those decisions. But again, most memory problems at 60 are not Alzheimer's. They're caused by treatable, reversible conditions: sleep problems, medications, vitamin deficiencies, Thyroid issues, depression, dehydration, stress. These can all be addressed. In the meantime, there are things you can do to support your brain health. Get regular exercise. Physical activity increases blood flow to the brain and promotes the growth of new brain cells. Stay socially connected. Engage in mentally stimulating activities. Learn new things. Do puzzles, read, have conversations. Eat a brain-healthy diet. Lots of vegetables, especially leafy greens. Fatty fish, rich in omega-3s. Berries, nuts, olive oil. The Mediterranean diet has been shown to protect against cognitive decline. Manage your stress. Practice mindfulness or meditation. Get enough sleep. Stay hydrated. Limit alcohol. Control your blood sugar and blood pressure. All of these things protect your brain and can improve memory and cognitive function at any age. The bottom line is this: memory problems at 60 do not automatically mean Alzheimer's. There are so many other potential causes, most of which are treatable. Don't suffer in silence out of fear. Get evaluated, get answers, and get the help you need. Your brain is resilient. With the right support, your memory can improve. You deserve to have that peace of mind.